Okay, so today we're going to be talking about infections of the circulatory system and the cardiovascular system. So the first thing that you really want to know is that the circulatory system consists of the cardiovascular system, including the heart, the blood vessels, the lymphatic system that consists of the lymph and the lymphatic vessels, the lymphatic tissues, and the lymphatic organs. So the infection and inflammation, when that occurs within the cardiovascular system, then it's going to cause things like cardiac and vascular disease. Once these microbes or this bacteria and viruses gain access to the lymphatic system or the cardiovascular system, then they can quickly spread throughout the body and infect any organ or system after that point. Usually bacteria and fungi cause endocarditis because they affect the endocardium, the tissue lining of the heart chambers. Viruses and parasites can cause this myocarditis. They affect the myocardium, and that's the heart muscle. And then pericarditis is infection of the pericardium, which is that membrane that surrounds the heart. And that's usually caused by bacteria, viruses, not very often by fungi. So the lymphatic system, it is going to return any excessive tissue fluid back to the cardiovascular system. So it has direct access to the cardiovascular system, and therefore a relationship exists between the two of them. Once the microorganisms are able to gain access to either one of the systems, then they can spread throughout the body and infect any organ. This is just an overview of the heart, so you can kind of have an idea of where everything is. The outside, you can see that's that pericardium. That's that sac that allows the heart to flow back and forth. Then you see the muscles or the inside part of the heart. All right, just so you know where everything might occur with the endocarditis versus the pericardium. So endocarditis is going to be in that tissue lining of the heart chambers. So anything that's lining these areas of the heart, okay, are considered the endocardium. And then the muscles within this heart, okay, is when it affects the myocardium, or we have the myocarditis. And then pericarditis is that fluid that's around the heart that kind of allows the heart to like glide in space. So endocarditis itself, we have inflammation of the endocardium or the lining of the heart or the heart valves. This condition can be classified as either infective, meaning that a microorganism is involved, or non-effective. If it's non-effective, then we usually will see like the platelet and the fibrin or the thrombi on the heart valves and on the surrounding endocardium. And that usually occurs in response to trauma. So that could be like some valve issue, some sort of injury there, or some sort of trauma to the heart, maybe because of some sort of ischemia, because of circulating immune complexes, vasculitis. And you might see this now a lot, especially with the COVID, especially with Kawasaki's with the kids. Vasculitis is one of the major issues with that disease process. And then a hypercoagulated state. So you might see that in someone who has either DIC, disseminated intravascular coagulation, or you might see it in somebody who's on high doses of estrogen, or somebody that has some sort of issue going on where the blood's just clotting all the time or too much. Infective endocarditis can develop slowly. It can be subacute or acute. It's going to cause things like fatigue, weakness, fever, chills, night sweats, other types of excessive sweating, weight loss, muscle aches, pains, joint pain. It can cause shortness of breath. It can cause the urine to be either an abnormal color or it can present with blood in it, in which case it might kind of have an iced tea or a reddish brown color appearance to it. The person can develop these red painless spots on their palms of their hands and the soles of their feet. Also painful nodes in the pads on the finger and the toes, and you'll see some abnormalities in the fingernail as well. So for treatment of endocarditis of the heart valves, it depends on if the infection involves a natural or a prosthetic valve. If it's natural valve tissue, usually they can use just antibiotics to treat it. However, if it's a fake or a prosthetic valve, then it cannot be resolved by antibiotics alone. Usually the prosthetic valves are caused by the fibrin or the platelet vegetating or growing on the valve, and that growth can then break away, go into the bloodstream, and lodge into the vessels and cause extensive damage. So for these type of infections with the artificial valve, okay, that requires surgery, usually to remove that growth or that vegetation and antibiotics. So it would be a combination. These type of infections are becoming more common because we see more and more people having these heart valves replaced. Back in the day, we didn't do as many of these types of surgeries, but now with new technology, we're treating more and more. So again, common causes of infectious endocarditis would be bacterial, but it also could be caused by fungi. And in some cases, they're not able to identify the causative organ that does cause this endocarditis. It does play a big, it does play a big toll on the body. It really will wear your patient down because, you know, the heart is not performing the way it should be. Go ahead.
So with IV drug abusers, they can get this endocarditis, right? So
they can. Anybody who has like an artificial valve or anybody that gets like dental work and they have things like AFib or other cardiac issues, we'll typically give them prophylactic antibiotics before they'll even get any dental work or certain things done.
Okay.
So that would be to prevent that. Okay. So definitely IV drug users, because they're shooting drugs right into the veins. And a lot of times they're using dirty equipment, dirty needles. So, you know, they can develop these blood infections that we're going to talk about in a little while, these septicemias or bacteremia.
Okay, thank you.
Now, with the myocarditis, that's that inflammation of the myocardium, which is the muscular part of the heart, usually caused by viral or parasitic infections, but it can also be caused by bacterial and fungi. Also exposure to chemicals or sometimes an allergic reaction. In this state, the cardiac muscle will become weakened, and that can lead to heart failure. Symptoms are vague, and that makes it difficult to diagnose. But sometimes we will see the following symptoms in the patient with myocarditis: chest pain, fever, shortness of breath, swelling of the legs, cardiac arrhythmias, and congestive heart failure. With pericarditis, that's the inflammation of the pericardium of the heart. It also can be caused by viruses, bacteria, and fungi. So when you think about this, think about the sac around the heart. That's actually where that infection is going to be. Also, again, a complication of viral infections, sometimes bacterial and fungi. So symptoms for this would be chest pain, difficulty breathing when lying down, dry cough, ankle, foot swelling, leg swelling, anxiety, fatigues, and fever. Microbemia is a term that we use to describe an infection that's occurring in the circulatory system caused by different microbes. And depending on the number and type of microbes, it could be asymptomatic, symptomatic, transient, continuous, intermittent. A large number of pathogens will produce systematic signs like fever, chills, rigor, sweating, malaise, fatigue, and sleepiness. So these bloodborne diseases are spread by contaminated blood or body fluids, and it can happen anytime we have exposure to the blood or the other body fluids, and then that infectious disease is transmitted. The bloodborne diseases can affect anybody that's exposed, but the risk of exposure is greater with certain occupations such as healthcare workers, emergency responders, public safety officers, teachers, and a few others. Pathogens of most concern for these professions, according to the CDC, are HIV, hepatitis B, hepatitis C, and anything that causes viral hemorrhagic fever. So that would be things like Ebola. These viruses are discussed in detail in chapter 21. Diseases that are not transmitted directly by the blood or by contact with body fluids, but are transmitted by an insect or some other vector would be classified as a vector-borne disease. So again, microbemia, we use that to describe infections, and it's caused by any sort of microorganism that enters the circulatory system through the lymphatic drainage. Sometimes this can happen through a localized infection. It can happen from if you have some sort of diseased skin or mucous membrane that are colonized by members of normal flora. It will depend on the number and type of microorganisms as far as those symptoms that we just discussed, and whether or not it's asymptomatic, symptomatic, transient, continuous, or intermittent. So again, the larger numbers of organisms, including pathogens, will produce more systemic signs and symptoms. For microbemia, treatment usually involves IV broad spectrum antibiotics. So that would be things like vancomycin, and you'll read about a few other ones, but it's usually not like your normal ones like penicillin or ampicillin or cephalosporins. It's usually going to be something like your mycins. So once these bacteria have access to the circulatory system, all right, they become widely dispersed, and they could cause something called bacteremia, where they infect a wide range of tissues and organs. If the bacteria in the circulatory system are not destroyed by the immune system or by the antibiotic treatment, then they can multiply in the blood and eventually cause septicemia. So bacteremia is the term that we use when we talk about bacteria being present in the blood. Normally, blood is sterile. The bacteremia would occur during things like a dental procedure where the person gets an infection, or we catheterize. And so the placement of that invasive or indwelling device causes those microbes to, we have that reservoir now, that portal of entry. So now these microbes can migrate up that catheter tube and into the body. Also surgical wound infections. So most of the time, if we have a good immune system, we can prevent that bacteremia. However, if the bacteria in the circulatory system is not destroyed by the immune system, like somebody who's immunosuppressed or the older population, which doesn't have a great immune system because, the kidney function is decreased, the way their antibodies work are decreased, or like an infant who doesn't have that fully developed immune system. So these kind of people are going to be more susceptible. And then that bacteria starts to multiply in the blood, and eventually it leads to the septicemia. Now with septicemia, okay, sepsis is toxic. And it's going to be caused by a spread of that bacterial that's in the blood, or the bacterial toxin that comes from the infected site. With septicemia, it is considered a medical emergency. It does require immediate medical treatment. And if it continues or persists, it will lead to septic shock and eventually death. The septic shock usually comes from low blood pressure or hypotension. All right. And even when we give the person fluids, okay, lactated ringers or, normal saline, they still remain with low blood pressure. And the problem there is it's not perfusing. The organs aren't going to get perfused. So we're going to see ischemia, and that's going to result in tissue death of those organs. Septicemia proceeds rapidly. Most common symptoms are going to be things like loss of appetite, fever, chills, lethargy, anxiety. The patient might become agitated. You might see an increase in the breathing and the heart rate. Excuse me. Rheumatic fever, this is caused by strep A. Okay, so what happens is the person gets a strep throat, or they might get some sort of strep infection, and they maybe either go to the doctor and get it treated and get antibiotics, and they don't take the full course of the antibiotics, or they're resistant to the antibiotics, so the antibiotic doesn't completely kill the strep infection. So it spreads, and they don't even realize that it's happening. The other case scenario is they get the strep infection. They don't realize it's a strep infection. They just think it's a sore throat. Maybe they gargle with salt water or do other things. The infection goes away, or they think it went away, but it really didn't. Okay. And so you have this low group A strep infection in the body, and the person develops rheumatic fever. Okay. So it will start to affect the heart, the joints, the brain, the spinal cord, and the skin. They may present with things like coughing or sneezing. And you have to be careful with that. Okay. Sorry. Because when they cough, sneeze, or they have the saliva present, either through drooling or if you drink after them or kiss them, okay, that saliva can transmit that rheumatic fever. Signs and symptoms of this are going to be chest and joint pain, fever, carditis, rash, and those nodules under the skin, and is going to be treated with drugs like penicillin, erythromycin, and that may be orally. Also cephalosporins, vancomycin would be IV, and then oxacillin. With gangrene, this is a complication of necrosis. So the tissue starts to die and it becomes black, and it's usually related to an interruption of the blood supply. So we're not getting flow down there. A lot of times you'll see this in patients that have some sort of circulatory issue like diabetics. They don't have filling down there, so they often can't tell when they've even developed a wound or when there's something going on, or other people that have arterial vascular disease. Okay, so the blood supply going to that area is interrupted, and it also could be infection. Okay, the gangrene and the ischemia, which means the tissues aren't getting any blood, so it starts to die. It mostly affects the extremities of the body, but it can also happen in muscle tissue and organs. These enzymes are released as the cells start to die, okay? And those enzymes will kill the other cells and tissues because they're toxic. So we have this perfect environment for them to breed in. And so a lot of bacteria will go to this area because it likes to grow there. So it has the perfect environment. The tissues are lacking blood supply, either because of the infection or the blockage of the blood not getting there. And so that also causes a place for these anaerobic bacteria to grow. You might see things like Clostridium, gram-positive endospore forming anaerobes. They like to grow in these conditions. Clostridium is typically found in the soil, but we also will find it in the normal intestinal tract of humans and some domestic animals. The most frequent bacterial species involved in gangrene is C. perfringens, but other species and other bacteria can also grow under these conditions. So usually if we're going to treat this, we would have to remove that necrotic tissue, or we may have to amputate. And antibiotics are not able to reach that ischemic tissue. Why? Because there's no blood flow going there. Okay, so alone antibiotics won't be effective. So we're going to have to put these patients in hyperbaric oxygen chambers, all right, or possible surgery. Now, really, the hyperbaric chambers, that's the way to go. But a lot of companies or insurance companies don't want to pay for it, and doctors don't always make that recommendation. But it's less invasive than the surgery. So that would probably be, for me, the first way I would want my patient to go. There's a few different types of gangrene that you should be familiar with. All right, we have the dry gangrene, and that's usually caused by ischemia. Starts at the distal portion of the limb, like the feet. And we'll see this in a lot of older patients who have arterial sclerosis. Okay, so hardening and constricting of those arteries and those little arterioles where the gas exchange takes place. Okay, other persons that might have this issue is those that have peripheral blood flow problems, like a diabetic. Internal gangrene, also known as white gangrene, and this is caused by bleaching of the internal tissues. And generally, you'll see this after a surgical procedure or some sort of trauma. And then wet gangrene, which occurs in the organs that are lined by those mucous membranes, like the mouth, the lower intestinal tract, the lungs, and the cervix. It's not associated with moist tissue, but bed sores are also considered a wet gangrene infection, because the toxic products that are formed from the bacteria inside the wound can be absorbed if the tissue that's affected is not taken out. So that's when you see them sometimes debriding those wounds. They're removing that toxic tissue and that environment for that bacteria to grow, so it doesn't kill the remaining tissue. If the toxic product that forms stays in that area, then that tissue would become infected by the bacteria, And then we would see septicemia or toxemia and eventually death. And then we have this gas gangrene. This is caused by bacteria that produces natural gas inside that infected tissue. Toxins that are produced by the bacteria cause necrosis of more tissue, and that leads to further bacterial growth. And if we don't treat this, then the person will die from it. All right, so there's a picture of it there. That's the dry gangrene.
Gross.
All right, zoonotic bacterial infections. So these are diseases or infections that can be transmitted from vertebrate animals to humans. There's over 200 zoonoses described, but not all affect the circulatory system. Some can be caused by bacteria, viruses, parasites, or other unconventional agents like prions. And we'll talk about those in a minute. One thing I did want to go over before we move on is brucellosis. This is caused by the Brucellus species. It causes fever, and it's also known as Malta fever, Mediterranean fever, or rock fever of Gibraltar. It also might be referred to as gastric fever. These brucella are gram-negative coccobacilli, and the mode of transmission is through direct contact with either cows or other animals that are contaminated with the bacteria. In the US, the most common cause of brucellosis is through the ingestion of unpasteurized dairy products. So most of the milk out there is pasteurized, but there are some like religious groups and I guess holistic types of groups that do like to consume these unpasteurized dairy products, so they are at risk. And also, as we see more and more people from other countries migrating into the United States, you might see them drinking these sort of dairy products. And so if they get infected, then you might have to treat them. Symptoms of the brucellosis are chills, fever, sweat, headache. Infections affect the central nervous system or the endocardium. Chronic symptoms include those fevers, chronic fatigue, and depression. Treatment varies based on the severity of the disease, but we would use drugs like doxycycline and rifampin if the person is non-pregnant. If they were pregnant, then we would consider the Bactrim, the trimethoprim, sultamexazole, which I believe is the double-strength Bactrim. And that would be given to children under 8 or anybody that was pregnant. So that was the brucellosis. Sorry, I was behind on my slides there. All right, so for the main thing for this one, right, flu-like symptoms, treatment with the antibiotics if needed. Person-to-person spread is rare, but it can occur with breastfeeding. Comes from that unpasteurized milk most of the time in the United States. And it's known as brucellosis or undulant fever. So when you think of the fevers, think about undulant fever. That might be how you see it described. All right, tularemia, also known as rabbit fever, caused by the Francisella tularensis, a gram-negative bacillus, and it targets the blood and the lymph nodes. Spread through direct contact with rabbits, ground squirrels, or through the bite of an infected tick, deer fly, or other insects. So rabbits, ground squirrels, and infected ticks, deer flies, or insects. Signs and symptoms of this tularemia are going to be fever, chills, headache, dizziness, muscle aches, joint pain, dry cough, anorexia, and nausea. And it's going to be treated with your mycins like streptomycin, gentamicin, fluoroquinolones, and doxycycline. So the next one is my favorite, and that's cat scratch fever. Cat scratch disease. Y'all don't know Ted Nugent probably, but he made a song called Cat Scratch Fever when I was a teenager. Good song if you ever get a chance to hear it. All right, this is caused by Bartonella henselae. It affects the lymph nodes and it will cause a systemic infection. It usually comes from cat bites or exposure of the eye or a lesion to the infected saliva from that cat. So usually it caused, people doing rough play with cats. And so what we would do is discourage them to this rough play with the cat, because when the cat reaches out to play, that's when they put the bite or the scratch on. Signs and symptoms would be fever, fatigue, headache, malaise, swollen lymph nodes. We don't usually give antibiotics for this, but if the person was immunosuppressed or at a high risk, then we probably would. And if we were going to treat it, then it would be something like a cephalosporin, erythromycin, or doxycycline. So when the cat first scratches them, what they'll get is like a little bump, and then they'll get a little bit of swelling of those lymph nodes. And that usually means that there's been some sort of transmission of this disease to the person from the cat. Rat bite fever. This is a systemic infection. It doesn't happen very often, and it usually happens after someone is either bitten or scratched by an infected rat. All right. A lot of times you'll see this with people that handle rats on a routine basis. Or if they ingest water or food that was contaminated with some sort of rodent or rat excreta. Hence why they tell you to wash the tops of your cans and soda cans and all that stuff that are sitting around in warehouses, because they get contaminated with this feces from the rat. Okay, and if the rat has this infection, then when you open up and drink, okay, you could possibly contact that infection. All right, so it's caused by Streptobacillus monoileiformis, and this is a facultative anaerobe pleomorphic gram-negative bacteria. It's the most common cause of rat bite fever in the U.S. Spirillum minus, a gram-negative spiral-shaped bacteria, is the most common cause of this rat bite fever in Asia and Africa. It cannot be transmitted from person to person, and symptoms of the disease occur approximately 2 to 10 days after exposure, and includes abrupt onset of chills and fever, vomiting, pain in the back and the joints, headache, and muscle pain. About 2 to 4 days after that fever comes on, then the person will develop a rash on the hands of the feet. The large joints can become swollen, red, and painful. And we would treat this with antibiotics, things like penicillin, erythromycin, or tetracycline. Complications of this rat bite fever include pericarditis, endocarditis, and parotitis, or inflammation of those parotid glands, also known as mumps, an abscess in the brain or soft tissue. If the disease is left untreated, it can kill the person. All right, next we're going to be talking about the vector transmitted bacterial, viral, fungal, and protozoan infections. So when you think about vectors, think about animals capable of transmitting infectious disease like flies, ticks, mites, fleas, and rats. Insects are the major cause of human mortality and morbidity due to the transmission of infectious pathogens by these blood-feeding species. The transmission of vector-borne diseases is based on a complex relationship between the parasite and the vector and the human. These are mobile and they add a dimension to the range of transmission of infectious diseases because they can move around quickly. The person doesn't have to. So first we'll talk about the plague. This is caused by the organism Yersinia pestis, and usually it targets the lymph nodes, and then it goes systemic. It comes from a flea bite that bit an infected rat or rodent. So the flea bit the rat, got infected, and now the flea bit you. You'll see swollen lymph nodes, usually in the groin, the armpits, the fever, muscle cramps, seizure, gangrene in the extremities. And it's treated with antibiotics as determined through, susceptibility testing. So what that means is they test you for the infection, and then they test you to see what antibiotics are susceptible to it, meaning what antibiotics will kill it, or what antibiotics have an intermediate, so they kind of work but not great, or some antibiotics are resistant to killing it. So they look at those three things, and that's how they classify what antibiotic, and this is for any disease process that is caused by bacteria. They look at those three things when they culture the wound, or they culture for the bacteria to see what it is, and then they test it against the antibiotics to see which ones are actually going to kill it the best. So that's why sometimes you'll see a specific antibiotic ordered for someone. They'll culture the wound, they'll give them an antibiotic, and then a couple of days later, the doctor will call that person back and say, listen, we're changing your antibiotic because the one that you're on isn't going to respond as well, or we don't expect it to respond as well to this type of antibiotic. So we're changing you over to this because this antibiotic showed that it was more effective on this particular bacteria. Rocky Mountain spotted fever is the next one. Oh, we didn't talk about, I'm sorry. Well, let's talk about the different types of plague first. The bubonic plague, okay, you should be familiar with that. If anybody saw the Titanic, okay, that was the bubonic plague. And what happened is these people all came over on these boats, okay, thousands of people were housed in these boats with these small cramped rooms. The conditions for sanitary were ridiculous. Along with the people came rats because there was food and crumbs and places that these rats like to go and eat. Some of those rats were infected. And along with the rats come the fleas because the fleas like to piggyback onto the rat. So they piggyback onto the rat, they feed off the rat, and then they go in your bed and they feed on your blood and they deposit the bacteria into your blood. So usually what happens is sometimes when you scratch whatever they deposit, you scratch and that goes into your blood, or when they do the actual feeding, they deposit it right into your blood, depending on the bacteria. So with this, the bacteria from the infected flea or the person that's handling the infected animal gets that bacteria. And then the bacteria enters the bloodstream and it proliferates in the lymph and the blood, meaning it rapidly grows. This Yersinia pestis can reproduce in the cells. So even if it's phagocytosed or eaten, or tried to break down, it can still survive. Once the organism enters the lymph node, it causes swelling of those lymph nodes, and that's going to be especially seen in the groin or the armpit areas. So the swelling are called buboes, and so that is what gave the disease its name, the bubonic plague, because they would have these little buboes, or these little areas of swelling in the groin, the armpits, and other places of the body. Because that lymph is delivered directly into the subclavian veins through the right lymphatic duct and the thoracic duct, it enters right into the bloodstream. So the bacteria in that lymph are now capable of multiplying in the blood. And that leads us to septicemic plague. So when you hear septicemic, think in the blood. All right. And then that causes septic shock. Once the septic plague occurs, all right, and that can happen directly through that flea bite, or again as some sort of complication. And then the patient can develop the pneumonic plague. All right. All forms of the plague can be treated with antibiotics in the early stage, but if left untreated, the septicemic plague will be fatal. The least common forms of that plague is the pneumonic plague, and that occurs if the bacteria are taken into the lungs. Then it can spread from human to human by air droplets. That's the only way it can spread, is if they get the pneumonic. Epidemics can be started this way, and that's how those epidemics came about in the Middle Ages. So now the mortality rate for that type of plague is nearly 100% if they don't catch it within the first 12 hours of that fever coming on. Vaccines are available for people who come in contact with infected fleas. Recovery from the plague will help the person develop a good immunity to it. And elimination of the plague right now is not realistic because you really can't get rid of the wild animals. So that means you're not going to really be able to get rid of the plague itself. But if they used like pesticides to get rid of rodents on things like ships, airplanes, or buildings, or any place else where there's a high population of these rodents, then they can help reduce the episodes. So that's one of those bulbos from the bubonic plague. Now, if they do develop that septicemic plague, things that you're going to see are blood clotting problems, diarrhea, fever, hypotension, nausea, vomiting, and organ failure. Again, that's where the bacteria enters the bloodstream directly through the flea bite or through the complication of the bubonic or pneumonic plague. And for these patients, they need early antibiotic treatment, respiratory support, and IV fluids. And remember, the pneumonic plague, that's the one that spreads person to person. It can spread from face-to-face contact, coughing, or sneezing. This person will start to develop symptoms about 1 to 4 days after exposure. All right, and they should be isolated from any other patient, okay, until the antibiotics have the blood count down and the fever down to where it's not infective anymore. Come here. All right, Rocky Mountain spotted fever. This is caused by Rickettsia rickettsii. This is an obligate intracellular pleomorphic gram-negative bacteria. It's transmitted to human and ticks through ticks. Its name occurs throughout the United States. It is a severe disease, and it's most frequently reported of the rickettsial illnesses. Incubation period is about 5 to 10 days after the bite of the tick, and these people will have non-specific symptoms, so it may look like they have something else. Signs and symptoms would be things like fever, nausea, vomiting, severe headaches, muscle pain, a lack of appetite, a rash about around 2 to 5 days after the fever starts, and then abdominal pain, joint pain, and diarrhea. The rash isn't usually seen till about day 6. Only about 35 to 60% of the people with the condition develop that rash, and about 50 to 80% of them will have the rash on the palms or the soles of the feet. The diagnostic for Rocky Mountain spotted fever is usually based on a combination of the clinical symptoms and a lab test. The antibiotic treatment would be given immediately, even if it was suspected, even before the lab confirmation is obtained. And we use doxycycline and chloramphenicol. Despite treatment, about 3 to 5% of people that develop it will still die from it. So you can see the rash there on the arms. Lyme's disease in the U.S. is caused by Borrelia burgdorferi. This is a gram-negative motile spirochete that is transmitted to a person by the bite of an infected black-legged tick. It's usually a deer tick, and it's usually extremely small. And the infection occurs in 3 stages. So early symptoms would be that rash with the bullseye. You'll see a picture of that in a minute. Fever and fatigue, headache, and stiff neck and muscle pain. In the early stages, it can be treated with antibiotics for a few weeks. The second stage can occur anywhere from weeks to months later if it's left untreated. The infection then spreads to the joints, the heart, and the nervous system, causing symptoms such as severe fatigue, myalgia, skin lesions, heart problems, meningitis, and encephalitis. The third stage occurs and may repeat itself with severe attacks of arthritis over the years. The B. burgdorferi can cross the placenta and cause damage to the fetus. Once diagnosed, the disease is considered reportable for the purpose of surveillance. There's your tick, and you can see next to a paperclip how small it is. It's pretty hard to see with the eye. These are super small ticks. And there's the bullseye rash. That's usually going to happen pretty close to whenever you're bit, like within a day. All right, ehrlichiosis. This is caused by several species of the genus, the Ehrlichia family, the family of the Rickettsiaceae, and members that are gram-negative, obligatory intracellular bacteria. The organisms primarily invade leukocytes. At first, they were believed to cause disease in things like dogs, cattle, sheep, goats, and horses, but some species have now been shown to cause disease in the human. Human ehrlichiosis is caused by Ehrlichia chaffinensis and was first reported in 1987 and the transmission occurs primarily by the Lone Star tick, or I call it the Texas tick, the Ambuloma americanum. Early signs are nonspecific and might resemble other diseases. At present, it's not sure if all people that are infected become ill, and it may be mild, and that causes people not to seek medical attention or report it. Incubation period is about 5 to 10 days, and the first sign of symptoms will include fever, headache, malaise, and muscle aches. And then other symptoms can include nausea, vomiting, diarrhea, coughing, joint pain, confusion, and a rash occasionally. Some cases, if left untreated, could cause prolonged fever, kidney failure, disseminated intravascular coagulopathy, meningoencephalitis, respiratory distress, seizures, or coma. The severity of the ehrlichiosis may be correlated to the status of the immune system of the patient, meaning if they're more immunocompromised, they may be more at risk for the severity of the disease. Treatment with appropriate antibiotics should be started immediately if there's a strong suspicion of the ehrlichiosis based on the clinical or the epidemiological findings. So we have typhus, we have epidemic typhus, endemic typhus, and scrub typhus. The epidemic typhus, this is caused by the Rickettsia prowazaki, and it's transmitted person to person by the human lice or louse, Pediculus humanus corporus. The bacteria will multiply in the gut of the louse, and they're excreted when the lice or the louse bite. The R. prawazuki then enters the human skin when the bite is scratched. The disease is usually self-limited and associated with poverty and war. So when people are exposed to things like clothing that are not frequently washed, or a body that doesn't have frequent hygiene, then you might see this more often than in just normal everyday people. Symptoms of the illness occur quickly and include headache, backache, joint pain or arthralgia, high fevers, red rashes in the middle of the body that tend to spread, nausea, vomiting, hacking, dry cough, abdominal pain, meningoencephalitis, and coma. If it's left untreated, the mortality rate is about 20%, and in the elderly or immunocompromised people, it could be as high as 60%. The endemic typhus is caused by the Rickettsia typhi, and it's transmitted to people by the rat flea. The symptoms are similar to the epidemic typhus. It's less severe, and more people recover from it. Death can occur in elderly patients or those with the immunocompromised system. And then scrub typhus. This is caused by the Orienta Sugamashi, a lot of big words here, and it's transmitted by chiggers found in areas of heavy vegetation, mostly in the far east, and it's referred to as scrub vegetation. The symptoms include fever, headache, muscle pain, cough, GI symptoms. The virulent strains of the organism can cause hemorrhaging and intravascular coagulation, or DIC. Treatment is with doxycycline, tetracycline, or chloramphenicol. Relapsing fever. This is caused by Borrelia recurrentis. And it's a gram-positive spirochete that is often transmitted by the body lice. It's also transmitted by ticks. It's a systemic febrile disease that happens throughout the world, but epidemics are more prevalent in overcrowded populations with poor hygiene. There are two forms. It can either be tick-borne or louse-borne, meaning it comes from lice. Relapsing fever. So louse-borne relapsing fever is transmitted in the human body lice, and it causes the epidemic form of the disease. Tick-borne relapsing fever is transmitted by the Ornithodoros tick, and it represents the endemic form of the disease. This fever, or this relapsing fever, is characterized by recurrent febrile episodes that occur in a period of 2 to 14 days, and the febrile periods themselves last between 2 and 9 days, with alternate afebrile periods of 2 to 4 days. Treatment of the disease includes antibiotics like tetracycline, doxycycline, or penicillin. Infectious mononucleosis. This is a virus. Viruses can cause a number of cardiovascular and lymphatic diseases. And with a few exceptions, most of them are more prevalent in the tropical areas. All right, so infectious mononucleosis, also called the Epstein-Barr disease or Epstein-Barr virus. And once you get it, it stays in your system forever. It just will either be active or dormant. It targets those B lymphocytes. We often call it the kissing disease because you can get it through infected saliva. Also, if people put their mouth on things like water faucets, you can get it from that way. So any way that you could come in contact with infected saliva. We usually see it in a lot of college and high school kids. They tend to share drinks and drink after each other. Signs and symptoms would be sore throat, fever, fatigue, swollen lymph nodes, and there's no specific treatment. It's going to be rest, hydration, lots of fluids. These kids are going to be sick for a while because it can sometimes affect the spleen and the liver. It's also called human herpes virus 4. Okay. Again, it's transmitted person to person through the saliva, most frequently in high school and college kids. Infects the B lymphocytes, and you may see a swollen spleen or a swollen liver. All right. So these patients are not permitted to play in any sort of contact sports or engage in any sort of activity that could involve rupture of the spleen. All right, cytomeglovirus infections, also known as human herpes 5, are spread from person to person through direct contact. It's considered a large herpes virus, and it will generally remain latent in the T cells, monocytes, and neutrophils. Symptoms include prolonged fever, severe tiredness, and large spleen. It is usually present in healthy individuals, and a strong immune system will keep it at bay. However, if you don't have a good immune system, then it's going to attack the body. It causes severe congenital birth defects if mom has it and she passes it to the baby. Vision problems and hearing loss can also be caused by this virus. So cytomeglovirus, human herpes number 5. It's going to affect the monocytes, the neutrophils, and the lymphocytes. It's transmitted through direct body-to-body contact. If the person's healthy, they may be asymptomatic, but if they're immunocompromised, then we may see prolonged fevers, chills, fatigue, malaise, headaches, and an enlarged spleen, and there's no specific treatment available for it. All right, viral hemorrhagic fevers. These are caused by Arinaviridae, Filoviridae, Bunyaviridae, and Flaviviridae. They're primarily occurring in the vascular system, so that's the area it's attacking. It's usually caused by direct contact with either the insect host or the infected rodent, and it can also be transmitted direct human contact. Okay. Fever, vascular system damage, bleeding disorders, high fever, shock, and death are going to be your symptoms. And it's treated with ribavirin for the Arinaviridae infection, antibody serum containing serums, and interferon therapy for filovirus infections. All right, so viral hemorrhagic fevers are a group of febrile viral illnesses, and they range in severity from mild to life-threatening. They can result in severe multi-system problems. Again, 4 distinct families: the Arinaviridae, the Filoviridae, the Bunyaviridae, and the Flaviviridae. These viruses share a number of features, including they are ribonucleic acid viruses. They can be covered or enveloped. They have to have a natural reservoir, such as an insect host or another animal. They're usually geographically restricted, and that depends on the species of the host. Humans are not their natural reservoir, but the human can become a reservoir through accidental contact. The virus can be transmitted from human to human. Human cases during outbreaks caused by these viruses are generally sporadic and cannot be easily predicted. And with the few exceptions, there's no cure or treatment for the viral hemorrhagic fevers. All of these types of fevers are characterized by the following: fever, overall vascular system damage, and a bleeding disorder, which can progress to high fevers, shock, and death. The viruses that cause these viral hemorrhagic fevers are scattered over the world. Each virus is associated with one or more specific host species, and so the virus and the associated disease would be limited to that area or that geographic area where that host species lives. Transmission to humans generally occurs by contact with either a host, handling of infected animals, or their remains, their fecal matter, their urine, or their secretions. And sometimes the viruses can be associated with arthropod vectors, being spread by either mosquito or tick bites. The infected person can transmit the disease to another person through person-to-person, body fluids, or contact with contaminated objects, contaminated syringes, and contaminated needles. The people that are infected that travel to other areas of the country or the world can then infect people outside of their original geographical area. Fungal infections, okay, these can enter the body in the right conditions, and they'll generally enter through the lungs or the GI system, the nasal sinuses, or the skin. And then that fungi or fungus will spread through the bloodstream or the lymphatic system throughout the body. Most of the mycoses are discussed in the fungal infection section of the individual body system. Systemic mycosis are fungal infections capable of affecting all internal organs and becoming more and more common in the hospital. Clinical features depend on the specific organism that causes the illness or the organ that is affected. A person with a competent immune system will show only minor or no symptoms. Immunocompromised patients are at high risk for systemic mycosis, and that would include anybody infected with HIV, cancer, neutropenia, organ transplants, recipients, patients that are post-surgical for pancreatitis or a splenectomy, or anybody with poorly controlled diabetes. Also, anybody who's in intensive care, the very young and the very old. So to treat this systemic mycosis, we would reduce or discontinue the immune suppressing medications, or administer systemic antifungal medications. Prognosis would depend on the patient's immunity or immune function. And despite treatment for someone that's immunocompromised, the infection can become fatal. So the organism for the systemic mycosis usually includes Histoplasma capsulatum, Penicillosis marnifi, Paracoccidioides, Brasilinitis, and Coccidioides immitis. They're considered systemic infections, and transmission is through contact with the actual spores, or it can also be spread airborne, waterborne, and foodborne. Signs or symptoms would depend on the organism, but often would involve things like fever, malaise, pain, or discomfort in the affected area or organ. And again, treatment would depend on what the organism was, but we would use generally antifungal agents such as itraconazole, fluconazole, or amphotericin B. Protozoan infections, these cause diseases of the circulatory system, and they usually have a complex lifestyle. They also tend to cause unique challenges when it comes to treatment or control. The life cycles of many of the protozoa include intermediate host, which can allow for control by interruption of the infection by elimination of the transmission vectors. Once a protozoan infection has reached the human circulatory system, then it becomes a problem to treat it. And many of the drug therapies that target the eukaryotic organisms are toxic to human cells, so that makes it even more difficult to treat. So malaria caused by Plasmodium vivax, Plasmodium falciparum, Plasmodium ovale, or Plasmodium malariae. It targets the erythrocytes, and then it creates a systemic infection. It comes from the bite of an Anopheles mosquito, blood transfusion of infected blood. So either one, either the mosquito or the blood transfusion. Signs and symptoms would be fever, chills, sweats, headache, nausea, vomiting, body aches, enlarged spleen, jaundice, enlarged liver, increased respiratory rate, and in severe cases, we would see things like seizure, coma, severe anemia, pulmonary edema, and cardiovascular collapse. Drug of choice are good old Trump's drug, chloroquinolone, doxycycline, quinine, primaquine, primethamine, sulfadoxine, clindamycin with quinine, quinidine, atovaquac and proguanil, and artemether-lumefantrine. That was a mouthful. So these patients will most likely get this in a tropical or subtropical region unless they get the blood transfusion. Or they could get it from someone if they were sharing needles, okay? Wide range of symptoms depending on the age and the immune status. And we have uncomplicated and severe types of malaria. So malaria, we see the most common vector-borne disease spread worldwide, caused by those 4 species of the genus Plasmodium. The vector is the female Anopheles mosquito. Humans get infected through that mosquito bite, but also through transfusion or shared needles. The Plasmodium have this complicated life cycle that involves the sporozoites in the salivary glands of the mosquito. The merozoites, which are daughter cells, are formed in the erythrocytes and the gametocytes, which is found, gametocytes, which is found in the blood and in the infective stage of malaria. So we have uncomplicated malaria and severe malaria. With uncomplicated malaria, our symptoms will be mild. We might see jaundice or enlargement of the liver. With severe malaria, which is caused by the Plasmodium falciparum, becomes life-threatening and causes serious organ failure, along with severe anemia, cerebral malaria, hemoglobinuria, pulmonary distress, edema, and shock. And so we treat it with this chloroquine. That's the drug of choice, all right, for all malarial species except the Plasmodium falciparum. The drug is ineffective and requires other drugs such as mefloquine, quinine, atovaquone, the proguanil, and doxycycline. Prevention is by the use of DDT, dichloride, diphenyl, trichloroethane. So there's your life cycle. First, these sporozoites are injected into the host. So the insect bites you and starts to feed on your blood. And while you're doing that, it's injecting this sporozoite into your blood. The sporozoite then invades the liver cells and undergoes something called schizogony. This schizogony is where they have asexual reproduction. It occurs in some protozoas, especially those parasitic ones. And then the liver cells rupture and they start to release those merozoites into the blood. The gametes are ingested by the mosquito during that blood meal. After those merozoites have already infected the blood cells and produced those gametes. So remember those gametes, that's like the beginning stages of fertilization. We see gametes when we see growth in the cell. So gametes are the beginning stages that, something new is about to proliferate or grow. Then we have babesiosis. This is also a vector-borne illness caused by the Babesia spp. It's transmitted by ticks, also intracellular parasites, and can be diagnosed as malaria. This causes the red blood cells to act funky because they're going to reproduce inside those red blood cells. 2 hosts, an intermediate host, which is the white-footed mouse, and a definitive host, the deer tick. So humans are considered the dead-end host and then enter their life cycle as a mistake. Human-to-human transmission occurs through blood transfusions. So treatment would be quinine and clindamycin for a period of 7 to 10 days. Most common treatment is with the atovaquone or the azithromycin or the clindamycin. Toxoplasmosis. This is caused by the Toxoplasma gondii. This is a single cell cyst-forming parasite found all over the world. This organism will carry out its sexual reproductive cycle within the members of the cat family only. The cat is the definitive host, but other warm-blooded animals can act as an intermediate host. So we have transmission of the toxoplasmosis to humans in the following way: either by eating raw or undercooked meats like pork, lamb, or wild game, consumption of untreated water, through the fecal oral route, like after you garden or you handle cats or the kitty litter, through contaminated hands with anything that's come in contact with cat feces. It can also be transmitted from mom to baby if mom becomes infected while she's pregnant. And then it can also be spread through organ transplant or blood transfusions, but that doesn't really happen all that often. Treatment not usually needed, but if someone were pregnant or immunocompromised, then we definitely would want to treat it. And this is just showing the growth in the lung tissue. It's believed that over 60 million people in the US carry this parasite, the toxoplasma, but because their immune system is okay, they don't usually show symptoms. However, a newly infected pregnant woman or someone with a compromised immune system should be aware that severe consequences can occur for the unborn fetus, including brain damage, damage to the eyes, and other organs. Most people with toxoplasmosis do not require treatment, but for someone who is pregnant or immunocompromised, we would definitely want to treat. Chagas disease, this is referred to as American trypanosomiasis, and it's caused by the Trypanosoma cruzi, a flagellated protozoa, and it's transmitted to humans and other mammals through vectors, insect vectors that are found only in the Americas. So like Latin America, all right, and usually the ones that have a lot of poverty. Estimated that 8 to 11 million people in Mexico, Central America, and South America are infected, and in the United States, an estimated 300,000 infected. Most of them not even knowing they're infected. The infection is lifelong, and if not treated, it can be life-threatening. There are two phases, the acute phase and the chronic phase. The acute phase of the disease lasts for the first few weeks or months after infection, and then it's often unnoticed because symptoms are mild and not necessarily unique to Chagas disease. The symptoms include the following: fever, fatigue, body aches, headache, rash, loss of appetite, diarrhea, and vomiting. You may also see some enlargement of the spleen, liver, or swollen glands where the parasite entered. After the acute phase, a chronic phase can occur for decades or even life. Some people will develop cardiac complications, including enlarged heart, heart failure, altered heart rate, or arrhythmias, cardiac arrest. Furthermore, intestinal complications can happen, causing enlargement of the esophagus or the colon and leading to problems with eating or defecating. Treatment of the condition includes antiparasitic and symptomatic treatment. No vaccines are currently available. Leishmaniasis, this is widespread complex disease caused by parasites, protozoan parasites of the genus Leishmania. About 20 different species are involved. It can appear different ways, different clinical forms. So we have visceral leishmaniasis. This is a serious form and it can be fatal. We have cutaneous leishmaniasis. This is the most common form, and it will cause a sore at the bite that heals in a few months to a year. Diffuse cutaneous leishmaniasis. This causes widespread skin lesions and is difficult to treat. Mucocutaneous leishmaniasis. This causes skin ulcers that spread and cause tissue damage to the nose and the mouth. This infection is mainly caused by the female sandfly, found in tropical parts of the world and over near the Mediterranean. It's a small insect, and the bite is often painless and unnoticed. So depending on the type of disease, on what manifestations may occur in a few weeks or months after the bite. Although most forms are transmitted only by insects to human, some forms can be spread between the humans. The illness is commonly found in Mexico, Central America, and South America, but we've also seen some cases in southern Texas, southern Europe, Asia, and the Middle East and Africa. The CDC estimates there's over 1 million cases worldwide, and a dramatic increase of the cases in the U.S. over the last 10 years involve servicemen and women serving in Iraq or Afghanistan. So the circulatory system consists of the cardiovascular system, including the heart, blood, and blood vessels, and the lymphatic system, consisting of the lymphatic vessels, lymphatic tissue, and lymphatic organs. Endocarditis is generally caused by bacteria and fungi. And remember, it's going to affect the tissue of the heart. And sometimes you'll have growth around those heart valves or vegetation around those heart valves. Myocarditis, more likely to affect those muscles of the heart. That's going to be caused by the viruses and the parasites. And then pericarditis, which affects that outer sac of the heart, caused by bacteria, viruses, and sometimes fungi. Exposure to blood and other body fluids can transmit infectious disease and prevent a problem worldwide to different occupations, especially healthcare workers, emergency response teams, public safety personnel, and teachers. And we see a lot of these with HIV, Hep B, Hep C, those kind of things. Bacteremia is the presence of bacteria in the blood. And if that bacteria starts to multiply and spread throughout the system, then it becomes septicemia, which is the multiplication of bacteria in the blood. Rheumatic fever, we talked about this. It's a common complication after we have that strep A infection, especially if the infection is not fully treated. And you're going to see like joint pain and inflammation with this. Okay. Gangrene. This occurs mostly to tissue death. Okay. And then that tissue death leads to additional toxins being released into blood and killing other tissue further. Zoonotic diseases. This is these diseases that are transmitted from the vertebrae of animals to humans. All right. And they are an emerging field of conservation medicine. So that's those diseases like the brucellosis that's spread from the cattle, the Tularemia from those rabbits and those ground squirrels. Vectors are animals that are capable of transmitting diseases, and they include things like flies, mites, fleas, ticks, and rodents. And remember, they're carrying things like that bubonic plague. And then if that bubonic plague puts toxins into the bloodstream, it becomes septicemic plague. And if it goes into the lungs, then we develop pneumonic plague. Pneumonic plague is the only one that can be spread person to person, and it's usually spread when someone coughs or sneezes. Viruses can cause a variety of circulatory diseases with the exception of infectious mononucleosis. And most viruses are prevalent in tropical areas, most prevalent. Okay, fungi can enter the body through the lungs, the GI tract, or the paranasal sinuses or skin. After entry, the fungi spread in the bloodstream or the lymphatic system, and then the infection becomes hard to treat. And then we have these protozoa that cause diseases in the circulatory system of humans, and they have a complex lifestyle. And this includes the most common one, which is malaria, the babesiosis, the toxoplasmosis. Remember that has to do with the cats, the Chagas disease, and the leishmaniasis. All right, anybody have questions about that part? And I sent you guys the answers for your review questions so you can practice them and then check them to see if they're correct.
Thanks, so.
All right, so we're going to hit chapter 24 now. Emerging infectious diseases. So emerging infectious diseases are basically diseases that we are newly identifying within a population, or it could be a disease that previously existed, but it's changed. And so now we're seeing an increase in incidence, or it could have been something that is currently going on or that happened in the past, and they have a potential to increase in the near future. These emerging diseases could be caused by a virus, a bacteria, a fungi, a protozoan, a helminth. Older diseases that have been known for a long time that were previously under control but are now reoccurring are called re-emerging infectious diseases. So one of those that you're going to see right now is measles. All right, so emerging infectious diseases, diseases that are newly identified in a population. It can also include diseases that previously existed but have now changed. It's caused by things like viruses, bacteria, fungi, protozoans, or helminths. And then the re-emerging infectious disease would be something like measles, an older disease that was known for a long time that was previously under control but is now reoccurring. So we have this increasing international threat of infectious diseases, as we see with COVID. All right, the introduction of the pathogen gets put into the new host population, and then the establishment and further spreading of the pathogen within that new host population is a process referred to as adoption. These new infections often seem strange, but there are usually specific factors that are responsible for the emergent. Some infectious diseases have successfully been controlled by modern technology, and these new ones, such as HIV or AIDS, severe acute respiratory syndrome or SARS, West Nile virus, and Ebola are continually appearing and on the rise. Also, we see other infectious diseases like malaria, TB, bacterial pneumonia reappearing in strains, and they're reappearing and they're also resistant to the antibiotics. So it's not just that they're reappearing, we're not able to fight them the way we were to in the past. So some factors that are responsible for the emergence of these new infectious diseases include our demographics, our behavior, ecological changes that have occurred, and agricultural development, along with the increase in international travel and commerce, technology industry, and the microbial adaptation and change. Breakdown of different public health measures, such as people not taking advantage of vaccines, different humans being susceptible to infections, climate and weather, economic development and land use, war, starvation, and the intent to harm. So when we talk about human demographics and behavior, we talk about how people now migrate to areas where they didn't before. They're populating all these different areas that previously people didn't live in. War can also be a significant factor in the emergence of these diseases, because it forces populations to be moved. Like in Afghanistan, with the war that's going on there, a lot of those people had to be relocated. So a lot of them ended up in the United States. Some ended up at the borders. Some are still in Afghanistan, and some have come here and now left. All right. So this encourages people to move from rural areas into cities sometimes, or vice versa. In the 20th century, we saw rapid urbanization occurring. So people began to populate and cities began to spread. All right, so that density in the urban areas makes it easier for the transmission of these disease processes, because it allows the infections to arise in the isolated rural areas that previously remained vague or localized, to now reach the large urban population. Once in the city, the disease not only spreads locally, but it can be spread farther, because people travel. They travel across trains, they travel along the highway, and they travel by plane. And as they travel, if they have these infectious diseases that are being transmitted person to person, the disease is going to travel with them. Well-known examples include STDs and IV drug use, which have also contributed to the emergence and the spread of the HIV, AIDS, and hepatitis. Also, daycare centers. These are a way of life and a place where a lot of different diseases are spread. According to the FDA, more than half of all moms with young children have jobs outside the home, so they're using those daycare centers. And that is a definite focal point for certain infectious diseases that can easily spread in the center and into the community. Also, we have people growing older. Okay, so that's going to also spread more diseases, because as we grow older, our immune system doesn't fight as well as it used to. It makes us more susceptible to certain diseases and certain cancers. Opportunistic organisms, meaning organisms that look for immune systems that aren't normally functioning, can now go into these hosts, okay, and set up shop, and cause this person to develop an infection because they don't have the immunity that they need to fight it. Other changes are changes in the ecosystem. Frequently identified as factors for emerging infectious disease. And this is because we have changes in the way we practice our agriculture, changes in the way that our economic situation is being developed, and changes in the way we use our land. So the ecosystem is being disturbed every time we're making a new development, or every time we're going into an undeveloped area and developing it. We're disturbing that ecosystem. So this can cause unrecognized diseases to occur, and it can also cause zoonotic diseases to come forth that weren't previously a problem. Ecological changes often put people in contact with a natural reservoir or a host that may be unfamiliar to the population that's going into that changed area or that changed environment. So we do things like build dams. We get rid of forest by thinning them out and removing some of the trees. And this causes changes in the ecological makeup of the land. And that's going to influence the waterborne and vector-borne disease transmission as well. Movement of people into these areas will also expose a larger population to wild animals and potential disease vectors. Agricultural development and urban development are the most common ways that society alters the environment and now introduces these microbial challenges to the population. Also, international travel. So we have people that travel all over the world. Some of them have diseases while they're traveling, and some of them may get diseases while they're traveling to these areas. Okay, so they get this exotic disease and then they travel with it. And sometimes that results in them bringing things back to the United States that wouldn't normally be here or to other areas. So an example of this is in the 16th and 17th century, we had all these ships coming over from Africa to the New World, and along with those ships were people. And some of these people were infected with things like yellow fever. All right. And there may have even been mosquitoes on that ship. Because when you load the ships, other things come on the ship. Also in 1967, Germany decided to import monkeys into their country to do a lab experiment. And these monkeys had a virus. And the virus spread from the monkeys to the human handlers and the staff that were taking care of some of the people that were infected and the monkeys. So they ended up with this virus called the Marburg virus, and 7 deaths occurred during the first outbreak. So now there's a lot of outbreaks with this virus in a lot of countries. And so, you know, this is just one example of how moving or making changes to the environment, bringing over animals that aren't necessarily from this country, or bringing over people that could be infected. Mosquito-borne malaria is one of the most frequently imported diseases into non-endemic areas. The Ebola outbreak in Central Africa and included at least 5 countries of West Africa, and it is being spread potentially throughout the air, all right, and throughout the world within a matter of days. Also, foods that are imported from other countries, okay? A lot of those contain little vectors or little insects that hitchhike on these products, and then they come into the country, and then they start to multiply, and they can cause diseases also. Technology and industry in food and healthcare has made a positive impact on the quality of life, but it also brings about spread of infectious disease. Modern production measures tend to look at increased efficiency, and they will reduce cost, and at the risk of reducing those costs, take a chance of things being accidentally contaminated because they're not necessarily following a certain standard or a certain regimen. So when that happens, we get a globalized problem. Okay, we can get microbes from different parts of the world, especially if they're importing goods and they're doing things with them here in plants and they're doing bulk processing. Okay, microbes could be also present in the raw material that they use on the final product. So you could have a lot of those microbes in there, depending on how much was used in the raw product or how much was introduced to the raw product. Also, animal feed ingredients. Okay, so when we make feeds for animals, they include sometimes rendered animal products, animal waste, antibiotics, metals, and fats. And these also increase the potential for higher levels of bacteria, antibiotic resistant bacteria, prions, and dioxin-like compounds in the animals. And the animals consuming these feeds then become food products that are intended for human consumption. So, you know, the old saying, you are what you eat. The FDA does monitor the practices. However, infections still do occur. A lot of the technological advances have been made in healthcare during the 20th century, but there's also been a dramatic increase in the reporting of nosocomial infections. And this is due to the development of the antibiotic resistance. So we're trying to decrease, you know, antibiotics, how many we're prescribing, and also the frequent use of them when we don't need them, so that people don't become resistant to them. So just like every other organism, these microbes will constantly evolve, but at a much faster rate because they rapidly reproduce and because of these generation cycles. So microbes like bacteria and viruses can adapt quickly to a changing environment. And that's the reason why we sometimes have the emergence of these new pathogens. Almost all RNA viruses like influenza, HIV, and hemorrhagic fever undergo frequent and unpredictable genetic mutations. And you've already seen this with the H1N1, the swine flu, and now COVID. We have these different strains developing, or these genetic mutations. These microbes have an enormous evolutionary potential because they can undergo changes as well as be able to avoid the immune system of the host. So they can quickly adapt to new environments, often enhanced by activities that we do. So things like not taking the full course of the antibiotic, not doing proper hand washing. Antimicrobial resistance due to the overuse of antimicrobial drugs and failure to ensure proper diagnosis and adherence to treatment. So also things like not culturing the wound and making sure that it's susceptible to the antibiotic that we're using. Widespread use of antibiotics and other microbials has resulted in evolutionary adaptation, enabling these microbes to survive many powerful drugs. So they're resistant to these drugs, okay? The antimicrobial drug resistant strains are a continuing source of emergency infections and diseases. And you see it with things like MRSA and VRE. RNA viruses, such as the flu, can change in two different ways. One's referred to as the antigenic drift, and one is the antigenic shift. The antigenic shift involves at least two strains of viruses or even different viruses combining to form a new virus, and then they infect different species, like a new strain of the avian flu virus. In an antigenic drift, there are small changes in the viral coat or the surface of the proteins that happen over time. This can produce a new influenza virus strain that may not be recognized by the body's immune system. So the virus has this new coat on, and antibodies produced earlier due to an infection or vaccination don't recognize the new strain, and they're no longer effective against it. This is one of the reasons why people can get the flu more than once. The flu vaccine actually contains 3 strains. All right, one virus with 3 different coats. And one or two of the 3 strains are usually updated each year to keep up with the changes. So when we're making the flu shot, that's what they're doing, trying to make it effective against these different strains. Also, we have some breakdown of human public health measures. So public health and sanitation measures have proven their effectiveness at minimizing infectious disease. But if we have any breakdown of those health measures, it can be responsible for the emergence or reemergence of a disease. Human exposure to the pathogens spread by traditional routes such as food and water supplies can be largely controlled by appropriate health measures. We need to do proper immunization and control vectors like those mosquitoes and ticks to inhibit the reemergence or the emergence of infectious disease. Many infectious diseases can be adequately controlled even in areas that are endemic for a particular microbe. For example, cholera can be controlled by providing sufficient sewage disposal and water treatment. So in places like Mexico, where they don't do that, you'll see that the cholera is present, and it's very present, okay? So much that they tell you don't drink the water, don't eat the ice cubes, don't do any of that because the water's not sanitized. So in the United States, most of this water is safe to drink. Lapses in these public health measures in both developing and undeveloped countries, can cause the reemergence of many previously controlled diseases. Inadequate vaccination programs can lead to outbreaks of things like diphtheria and increased numbers of pertussis cases. Some people don't like to get the vaccines because they fear that the vaccines, especially those containing thimerosal, cause an increased risk for autism. So a lot of people use that and religion purposes and things like that to not get the immunizations. Other factors, okay, that are included are human susceptibility to infection. So a compromised immune system to things like HIV infection or a transplant or some immunosuppressive drugs, chronic disease, okay, or aging increases the susceptibility of the human to the emerging and reemerging disease. Poverty, malnutrition, and poor living conditions can increase susceptibility. War and famine. Casualties in modern wars are not soldiers but civilians as a result of destruction from water supplies, malnutrition, and collapse of the public healthcare system. All these contribute to the emergent and reemergent of infectious disease. And then climate, weather, natural disasters, things like that we're seeing around the world right now, like these tsunamis, the hurricanes, these earthquakes, these volcanic eruptions, fires like the ones out in California. These simple changes in weather patterns force the microbes to adapt to the new environment for survival. And they possibly create new strains of organisms that are capable of causing these new diseases or causing the reemergence of an old disease-causing strain. And then we also have to worry about bioterrorism and biowarfare, because a lot of these countries like the United States and Russia, they still have things on hand like polio and other disease-causing agents that they could throw out there and do biowarfare or bioterrorism whenever they get good and ready. Types of emerging and re-emergence diseases are 4 major groups. So we have the new emerging diseases that previously have not been known, like hantavirus, Ebola, and AIDS. We have the re-emerging diseases like TB and malaria. We have new manifestations of disease agents like genital, respiratory, and cardiac manifestations of chlamydia. And then introduction of known agents into the new geographic territories, such as the rapid spread of West Nile virus and Zika virus in the US. The National Institute of Allergy and Infectious Disease has classified the emergent and re-emerging infectious diseases into only 3 groups. Group 1, pathogens that have been newly recognized in the past 2 decades. Group 2, re-emerging pathogens. And Group 3, agents with bioterrorism, potentially subdivided into categories A, B, and C. Only the National Institute of Allergy and Infectious Disease A organisms are included in the tables of this chapter. Bacterial, viral, and fungal protozoan and prion related emergency diseases are included in these groups. But according to the CDC, almost 70% of emergent infectious disease episodes in the last decade or more have been the zoonotic diseases. The recurrent examples of infection originating as zoonotic suggest that the reservoir of these infections is a rich source of emerging diseases, and the appearance of new zoonosis indicates that this pool is not exhausted. Although zoonotic agents do not generally spread easily from person to person, other factors discussed previously might help transmit the infection. So we're talking about things like anthrax, cat scratch disease, Lyme, borreliosis, botulism, pseudomembranous colitis, ehrlichiosis, tularemia, peptic ulcer with the Helicobacter pylori, MRSA infections, the group A strep infections, plague, and TB. And then we also have these MRSA resistant infections, enterovirus infections like the hand, foot, and mouth disease, respiratory illnesses such as the Hendra virus, Hep C, hepatitis E, human herpes virus, and that was discovered through Kaposi sarcoma, which is something we see frequently in our HIV patients, human herpes virus 6, which is associated with roseola, and Fit disease or human parvovirus. So you guys can go through these slides. There's a lot of them. It tells you how the disease is transferred, what the organism is that spreads it, and what group it falls under. There's a couple of them in there too I didn't go over. And then the protozoan emerging and re-emerging, the acanthamosis and the babesiosis. So as far as global concerns, okay, the microbes can be transmitted across the borders daily. We have these international emerging infections. That's part of the CDC's global disease detection. So we need to use things like surveillance, all right, so that we can control the outbreaks and the endemic diseases both in the US and abroad. These things that we could do to help this is diplomatic and economic benefits, enhancing security. So we have to use surveillance, and we're looking at clinical symptoms, especially things like respiratory disease, acute diarrhea, encephalitis, meningitis, hemorrhagic fever, any unusual clustering of diseases or deaths, any resistance to common treatments of drugs. All right, and the epidemic is detected through the routine surveillance or through this cluster of cases that appears to be unusual as recognized by some healthcare provider. Or, you know, could be recognized by like a facility that you work at, like a hospital or a nursing home, where they have so many cases over a certain time period, and then those symptoms would be reportable. We also have to investigate the cause of the outbreak or the infectious disease, and that doesn't matter if it's new or re-emerging. We need to look at what the cause is and identify how it's transmitted and things that we can do to possibly treat it or stop the transmission. So we look at epidemiological investigation, environmental investigation, and interaction with the public. So if the investigation is done after the outbreak, it may still help us prevent other outbreaks. Recognize new disease, evaluate the existing prevention strategies, address any public concerns. And then the response, okay, will depend on if the disease should be a public health response, utilizing different methods, or to prevent infection. So a response could be like an immunization program, okay, or other things that interrupt the transmission process, like using insecticides, quarantine, recalling foods, things like isolation. All right. And so if we avoid transmission, teach education, and do these campaigns, then we can combat the response. So one of the roles of the CDC is to protect people in the United States from the infectious disease and from spreading it. So they give that education, okay, and they tell us how things can be spread from person to person. We also have to be cautious of the expanding international travel, how easily these infectious microbes can be transported across the different borders daily, and how they can be carried by infected people, animals, or insects. We also have to take a look at commercial shipments that might contain contaminated materials or foods. And the National Center for Infectious Disease works with the CDC to do this. All right, they now have the NCID, and they're going to help with protection of domestic and international populations. Also, they're looking at epidemiology, lab studies, and the use of quality systems to establish standards and practices on how they respond to these infectious diseases. So again, they look at 6 areas: international outbreak, the evolving approach to surveillance globally, applied research on diseases of the global importance, identification of proven health tools, initiatives for disease control, and public health training with CDC reports. Nationally notified diseases. So we need to report all diseases that are reportable, monitor, prevent, and control those infectious diseases. Again, the CDC is the leading U.S. federal agency, and its job is to provide information, recommendations, technical assistance to state and local departments. We use surveillance. We use investigation through the cause or the epidemiology, how the environment has changed, and interaction of people. So, you know, how they behave and what things we can change in their behaviors to limit the transmission of some of these diseases. Questions? Okay, that's it. I do have another session, so I won't be